So I had multiple issues. Mainly it was my sleep. I had very bad quality sleep. I had been diagnosed with sleep apnea. I also had the issues with my pelvic floor that affected my libido,
Mm-hmm.
and some digestive issues and stuff like that. And I also had chronic ankle sprains and some hip pain as well.
Right. So how was your experience like with the training, and what week did you start to see changes and improvements?
So every week it was a bit, I could feel a bit of a difference. I think the most change I felt in the 11th, 10th or 11th week. Um, and it wasn't kind of a linear journey. Like sometimes I felt like there was some regression, depending on obviously things like digestion and how I was sleeping and stuff. But yeah, overall, I would say every week I could see like hints of progress.
Got it. And how is your ankle and hip pain issue now versus when you started?
So the hip issue, I think, as I mentioned before, so this week I felt the most progress, and I think it's slowly getting resolved. And ankle-wise, well, I haven't tried yet. Going to play some basketball. Probably go next week. So I'll see how it feels, and
What about
hopefully I'm not gonna sprain it again soon.
what about your running?
Yeah, running. As I said to you before the session, running felt really good today. It felt like I was flying.
Perfect. Great. So how would you, let's say you encounter a stranger on the street, how would you explain Hyperarch Fascia training to someone who never tried before and only know about weightlifting?
Oh, that's a tough one. I would say you really have to change like your mindset. You have to let like your preconceived notions of how the body works and kind of try to see it more holistically and try to understand that it's not like we don't just make movements with isolated body parts. So everything
Right.
works together, and you want everything to work together as one, and that means that you can use your whole body for everything that you do.
Right.
And
Exactly.
if you train that way, then it's gonna have the most effect.
Exactly. Exactly. So what messaging from, our social media made sense to you when you first discovered hyperarch fascia training?
Oh, well, for me, it was kind of I had kind of seen fascia before I saw you in social media, and I was kind of researching this whole thing. I had seen how fascia can relate to psychology and like different things, and I was trying to figure out like things like fascia release, foam rolling, and stuff like that, how it could affect like the different issues that I was having. And then at some point, I think I saw one of your videos. I think one of the first videos that I saw of you was the one that you say how you're supposed to squat to feel more glute activation, to put the marbles, under the toes, and you squeeze the marbles, and that's how you feel more glutes when you're squatting. And I saw that, and I started looking at your content, and it kind of made sense with everything, and the how this tissue kind of governs everything, right?
Yes.
In our health. So it felt like the first piece of the puzzle, or like the first domino that kind of is it creates this cascade effect for everything that follows.
Right.
So yeah, it was really after that it made sense to me.
Got it. Well, now you have experienced it after 12 weeks of training. Do you think this 22 kilo first kilo, do you think this is important?
No, not really. No, I'm kidding. It's super important. It's super important. I can't believe how it has been left out.
Yes. That's our mission, is to tell
Mm.
everybody that really interested in health and performance, you can't ignore this 22 kilo worth of material in the body, which accounts to almost 20% of the body.
Yeah,
Perfect.
exactly. I fully agree.
Very good, very good. So what do you feel now in the elevated tall crawls, which I ask everybody who completed the program?
So we just did them before. How much did they feel on the glutes? I think it was like a 5 or 6, right?
Yeah, you feel much more glutes now.
Yeah.
And, and
Much more glutes and hamstring and much less foot and calf.
right. And when you started at week 1, it was
It was all foot, I think, yeah.
yeah,
And
well,
Achilles.
it wasn't there. Just a lot of
Mm,
foot, calves, Achilles. It was very localized.
mm.
Yeah. So that's how we make the body more holistic and more responsive and healthy.
Yeah. And I can't wait to see where it goes from here. I feel like it's just the beginning.
Yes. Yes. Perfect. Yeah, but
Thank you very much, coach.
I don't think you're gonna have ankle problems.
Yeah.
Especially you're running already flying. That means you have good ankle stiffness.
I'm flying. I want to see how it feels on the court.
Yeah.